Right, so in this video, I'm going to discuss some PNF techniques. I'm specifically going to discuss techniques that are used with the diagonal patterns. So some PNF techniques are only used with diagonal patterns, some are only used with functional movements, and some can be both. Okay, so in this video, I'm going to specifically discuss the ones that are used with the diagonal patterns and just kind of review the diagonals in general. So for PNF, you have the G1 and G2 flexion extension for the upper extremity and the lower extremity. G1 flexion for the upper extremity begins in the extension position, extension at the shoulder, AB deduction at the shoulder, internal rotation, pronation at the forearm, ulnar deviation, wrist extension, and fingers are open at the hand. And then to go into flexion, you're going to pull your hand up and across your body. So then you're going to be flexed at the shoulder, externally rotated, supinated at the forearm, radially deviated, and wrist, fingers flexed at the arm, at the hand I should say. Okay? And then just go into the extension pattern is the opposite. So that's D1 flexion and extension. The D2 flexion extension pattern is for the D2 flexion, you're going to start this time with the arm across the body. So extension at the shoulder, internal rotation, pronation at the forearm, ulnar deviation at the wrist, and fingers flexed. And then you're going to pull your arm out and away. So now the shoulder is flexed. It's AB deducted. It's externally rotated. You have supination at the forearm, and you have radial deviation at the wrist, and the hand is open. So notice in the upper extremity that you have the extension pattern. You always have extension at the shoulder, internal rotation, pronation at the forearm, and ulnar deviation. With a flexion pattern, you always have flexion at the shoulder, external rotation, supination at the forearm, and radial deviation. Those are always going to be true. For the lower extremity, you have for D1, the D1 flexion pattern, you're going to start in the extension position. So you're going to have, for D1 flexion, you start with the D1 extension position. That's the hip extended, AB deducted, internally rotated, plantar flexion, knee extended, plantar flexion, and the E version. And then you're going to pull your foot up and in like that. So for the D1 flexion, you're going to be flexed at the hip, externally rotated. You're going to be dorsiflexed and inverted at the foot. And so for D1 extension pattern, you're going to go from here, from the flexion pattern to the extension pattern, right? So you'll be extended at the hip, AB deducted, internally rotated, and then plantar flexed and inverted at the foot. So with the lower extremity, generally speaking, flexion goes with dorsiflexion and plantar flexion goes with extension. The D2 pattern for the lower extremity is not used as often. It's a bit of an awkward pattern. For D2 flexion, you're going to start in the D2 extension position. So the hip is going to be extended, AD deducted, and externally rotated. You'll be extended at the knee, plantar flexed at the ankle, and inverted. And then you're going to pull your knee and your foot kind of up and in and your foot out. So now I'm going to be flexed at the hip, flexed at the knee, internally rotated, AB deducted, and then dorsiflexed and everted at the foot. So it's a bit of an awkward pattern. It's not used as frequently. So let's review the patterns. So techniques that are used directly with the patterns include hold, relax, contract, relax, slow reversal, and slow reversal hold. And I'm going to review those now. Go ahead. So PNF patterns that can be used for the extremities can be used for diagonals or straight plane movements. So for most of these techniques, I'm going to show just for a straight plane movement, and then I'll show it with a diagonal. So one of the most well-known PNF techniques is hold, relax, which is used primarily to increase range of motion, and it's most commonly used actually to increase kind of the hamstring length or the kind of hip flexor range of motion. So whenever there's a hold in PNF parlance, that always means an isometric contraction, and relax usually means the patient is supposed to relax. So in hold, relax, for example, I would see however far she had in terms of her hamstring length. So let's say it's here, okay? And then I'm going to ask her, I want to activate the antagonist. So I'm going to ask her to push down into my hand. And I should say for the legs, it's really helpful to put it on your shoulder. So push down into my shoulder. That's the hold. Now I want you to relax. Okay. Okay, so she should relax. And then I'm going to push her up a little bit more into increased range. Now I want you to push down into my shoulder. Push down. That's the hold. I want you to relax. And I'm going to push her up a little bit more. And so on until you reach the maximal range. So hold relax is a gentle technique. It's used a lot to increase range of motion. And you can also do that with a diagonal pattern. So for example, for say the G2 Flexion pattern. So I have her with her arm kind of across her body. Sorry, my hands are really cold. Kind of have her and her ulnar deviation, her arms across her body. So I'm going to ask you, let's say she's got a little bit of range, so just take it as far as she can go, and let's say it's about to there, okay? So I'm going to ask her actually to push down into my hand into the extension pattern, and then I'm going to say relax. And now I'm going to try to kind of pull her up a little bit, push down into the extension pattern because you want to activate the antagonist, and relax. Now I'm going to push her up a little bit, all right? So that would be hold relax for the diagonal pattern, all right? Another technique is something called hold relax active movements. Hold relax active movement is a movement predominantly used to kind of initiate movements. So again, I'm going to demonstrate with a straight plane movement first. So let's say I was trying to initiate shoulder flexion in Mary. So for hold relax active movement, she's going to put it where, let's say she can get her shoulder to about here. Okay, that's where her range is right now. So I'm going to ask her to activate her shoulder flexor, so to push against my hand. Okay, again, hold, that's the isometric contraction. I'm going to ask her to relax, so she's going to relax. And then I'm going to take her, I'm going to kind of do a stretch and take her in the opposite direction. So we're trying to go up. I'm going to actually take her down. And now I'm going to ask her, Mary, I want you to pull up. So pull into the flexion pattern. Okay, that's the active movement. And then we repeat it. I want you to push into my hand. I'm activating the flexors because I'm trying to initiate the flexor pattern. I'm going to ask you to relax. That's the relax. And then I'm going to take her down, kind of do a stretch, and then say pull it up again. Okay, so hold, relax, active movements. Okay, so the hold is that isometric contraction. The relax, she relaxes. Then you're going to kind of take it down, kind of do a stretch, and she's going to pull it back up again. So again, that could be done with a diagonal pattern as well. So let's say I was trying to do for the G1 flexion pattern. Okay, so I have her shoulder extended, adducted, I have her rotated in and have her ulnarly deviated. Okay, so let's say she can bring, so I'm asking her to bring her arm kind of up and in. Let's say she can go about halfway. So bring yourself about halfway up. So turn your arm up and in that way. Let's say it's about as far as she can go. She can go. So I want her to activate the agonist. She's going to push against my hand, push, and then she's going to relax. Okay, I'm going to pull her in the opposite direction and ask her to pull up. Pull up in the direction we're going and push against my hand. That's the hold. She's going to relax. I'm going to pull her away from the movement, and then she's going to pull it up. And then when they pull up, you can relax. You can add a resistance moment to that if you want to. So that's hold, relax, active movement. That's for movement initiation. Contract, relax is a technique that's used primarily for strengthening. It's a bit more of a complicated technique and one that I'm not super comfortable with. But the purpose of contract relax is to really get them, is really for strengthening. So let's say for the D2 flexion pattern, so I'm starting her with her arm extended, internally rotated, adducted, she's ulnarly deviated, all right? And so for somebody who, for contract relax, they're gonna have good strength. So I'm gonna go ahead and just take her through the movement first, okay? So we're gonna go into D2 flexion, and I'm gonna ask her, I want you to pull your arm out and away, okay? So like that. Okay, then pull it back in across your body, okay, and pull it out and away, and pull it across your body, all right? So now for contract relax, I'm going to try to give her the contract. You want to try to get a maximal contraction, and the idea is that you resist the movements except rotation, okay? So normally in the D2 flexion pattern, she's going to go from internal rotation to kind of an external rotation. So I'm going to let that part go, but I'm going to try to resist her as she moves into flexion and AB deduction, okay? So I want you to push against my hand, okay? And now we're going to hold it here, 1, 2, 3, 4, 5, and then keep pushing through, okay? And relax. So I can have her push, okay, and then do an isometric contraction, okay? Let it relax, ask her to pull back up again, and kind of go back and forth. So again, it's a kind of a maximal contraction. You're resisting the rotation, and there's usually a hold in there. Okay, again, it's a bit more of a complicated movement. And then slow reversal and slow reversal hold basically just refer to giving kind of a concentric resistance in a sort of a concentric way to the movements, and the hold just adds an isometric contraction into there. So let's say for D1 extension, okay. So she's going to start with her arm up across her body, with her fingers flexed, okay, and radially deviated. Okay. So first I'll take her through the movement. So we're doing D1 extension. So I want you to bring your hand down and out to your side, okay, and push, okay, and then up and across your body, and then down and out across to your side. Okay, and now I'm going to give her some resistance. So I want you to pull your arm up across your body. I'm giving her some resistance. Pull hard, and now push down, hand out and away, and pull it up and across, and down and out. So I'm giving her just resistance, okay, and then pull it up, and then wherever you want to switch, okay, so say here I'm switching, I can ask her to hold, okay, and then I let her go. Okay, so all slow reversal is, you can relax. All slow reversal is giving resistance, okay, in kind of both directions of the diagonal, or again, it could be done on a straight plane movement as well. And then the key is to kind of switch your resistance with the direction. And how much resistance you give is up to you. You can change it depending on what the patient's strength is. And then slow reversal hold just puts in a hold, an isometric contraction in there, okay. So let's just say for the lower extremities for slow reversal, let's do the D1 flexion pattern, okay? So she's going to start off with her leg abducted, internally rotated. She's going to be plantar flexed and kind of everted. So I'm going to ask her, I want you to pull your foot up and across your body, okay, like this, and then push it down and out and away from your body, okay? Push it up and across, and push it down and out. All right, and now I'm going to give you some resistance. I want you to pull against me. So pull up against me into that flexion pattern, and now push down. Okay, push up, and now push down. So that would be a slow reversal. Now push up. Okay, now here, before I switch, I can say, okay, I want you to hold it. Push really hard against my hand, as hard as you can. All right, and now let's keep going. So go ahead and push down all the way, like that. Okay. And then just to demonstrate, the D2 flexion pattern, extension pattern is not done as often, but in theory, the way that you would do it, okay, so I have her, remember the D2 flexion pattern starts in the D1 extension position, so extended at the hip, extended at the knee, she's adducted, she's plantar flexed and kind of inverted, and now I want you to pull your knee up and in and your foot out, okay, it's going to come like this, and it's a very awkward position, okay. So come, pull that knee is going to be up and in, and the foot is out. In general, when you give cueing for PNF, it's helpful to have the patient focus on the distal extremity, like either the hand or the foot, because if they put the hand and the foot where it's supposed to be, the other things will follow pretty closely. And those are some of the techniques used for PNF extremity movements.